This morning we're going to talk about cerebrospinal fluid. When I was a resident, like 4 years ago, uh, I had a mentor in medical school. I went to medical school at the University of Kansas, and there was a very famous neuropathologist there named John Kepish. Dr. Kepish described, amongst other things, pleomorphic xanthroastrocytoma. And I did a month of neuropathology, and I think he wanted me to stay and do the whole neuropathology life, and I enjoyed it, but I didn't have that special feel for it. So my tribute to him is that I kind of got into neurocytology, and I think another moniker or label for cerebrospinal fluid, which is CSF, is Chuck Sturgis fluid. What do you think? Right? It's a natural. So we're going to use this overview to go through the talk today. And the first thing I want to do is just a quick review of kind of anatomy and physiology of the CNS from the perspective of spinal fluid. So there are three, or depending on your perspective, potentially more routes of leukocyte migration. So in the way that largely lymphocytes can get into the central nervous system. Two of those are arterial, which are terminal branches of internal carotid arteries and deep penetrating branches of internal carotid arteries. So that's kind of the outer and the inner entrance via the circulation. And then the third route for leukocytes to enter the CNS is through the CSF itself. This is a slide that is way too complicated. The point is that CSF flow immunologically connects the CNS to peripheral lymphatics. So we all learned probably in medical school or in basic physiology classes, and from our concepts of looking at brain tissues under the microscope for histologic examinations, that there are no true lymphatic spaces within the brain proper. So if you want to mount like a cellular or humoral immune response, and you need lymphoid cells to get in and out in order to carry whether those are proteins that they're presenting as antigens, or if you're trying to mount an immune response that's humoral from B cells, you have to somehow get what you're wanting to trigger the response out of that environment and out into the periphery. And that can be like in the pharyngeal tonsils or in the regional lymph nodes, like in the upper cervical regions.